are very closely linked. And so we're going to see that going through. In some of these slides, I'm going to actually present the information together because it's so linked. And sometimes I will actually ferret them out. We'll talk about the differences and the treatments for the different things. But we're going to talk about this as a whole. And let's get started. So depression and anxiety. How do you know you have it? What does it feel like? What are some of the symptoms that you might be having if you're concerned you yourself have depression or anxiety, or a family member or a friend? So the symptoms up here, you'll see that there's going to be similar ones or even the exact same in both categories. So we're going to have a lot of change of mood. You might be a little bit more sad, more irritable, mood swings, if you will, trouble sleeping. Changes in appetite, that can go either way. Your appetite could go up, right? And you find that you're trying to feed your emotional imbalances with sugar, right? Or chips or chocolate or something like that. Or you can feel like, hey, I just don't feel like eating anymore, right? So either one. Sleeping issues, either not sleeping enough and insomnia, or sleeping too much because, again, you're kind of lethargic and you have low energy. So sleeping problems are on both sides. So are poor concentration or restlessness. Some of the difference is with anxiety, you're going to tend to be more wound up a lot of the time. You're going to maybe feel like your heart is racing, or it's trouble kind of settling down or sitting still, or even going to bed. You might find that you get more headaches. You might be sweating a little bit more, trembling even, depending on how you're doing. Depression tends to be a little bit more on the slower end of things, so you might have really hard time kind of getting out of bed, right? Low energy, feelings of guilt, feelings of worthlessness, like, oh, it's just not worth getting out of bed or going to the farmer's market. It's not worth doing things. And one of the big things is actually losing interest in things that you used to find joy. Right? Let's say you would go and spend your weekends golfing, or sewing quilts, or volunteering, and now you just can't even bring yourself to do it because it's just not fun anymore, or you just don't have the energy. That's a huge sign that we might have some mood imbalances or signs of depression. Now, causes of depression and anxiety are wide-ranging and very difficult to pinpoint, if you can imagine, because anything can kind of trigger these symptoms. Anything from major life events, right? Personal relationships, genetics. This is very much running in families, right? If you have long-standing depression or anxiety that your mom had and your grandmother had and all of your brothers and sisters have it, it is very common that you too will also suffer from some of these symptoms. So a lot of it is genetics. A lot of it is environmental as well, right? Not only we are our genes, but we are how we are in the environment as to how the genes react. So if we're eating poorly, right, these things might come up a little bit more. If we're having trouble sleeping, then we're easier to trigger, right, into the depression and anxiety. Brain chemistry. A lot of this comes down to hormone imbalances. We're going to talk about serotonin mostly, but there's other hormones that are in our brain that cause us to be maybe not as happy, or have more anxiety, or be more fearful. And so what that really comes down to is that no matter what caused this, these changes are real. It is a illness because this is a true change in the brain chemistry, if you will. So this is not something that, oh, just get over it, just snap out of it, you had a bad day. This is a long-standing, right, thing that you're battling with that a lot of times that maybe you don't know that you're really dealing with or having trouble with. And sometimes you really know and you've tried everything and you're just looking for some relief or some other help. So here are the hormones. We're going to start with love. Love, you're going to see your dopamine, your serotonin, and your oxytocin are nice and full. You feel great, right? You're loving someone. You feel that bonded connection. You're happy. all of that great stuff, right? Roses, sunshine, sunbeams, rainbows, however you can think about it. That's love and all those good hormones. And then you go up here, happiness. Serotonin is way up at the top. So now we know serotonin is a hormone that makes us feel good, right? Feels happy and we're having a good mood. So we're gonna go to depression. We're gonna, wow, my serotonin that made me feel happy over here is now very, very low, okay? And so is my dopamine. My dopamine level's low. My oxytocin, which is that love hormone, is very low as well. So now you start to see, oh, it's not just me. I'm feeling like this because my hormones are not in balance. Anxiety, almost nothing in serotonin. And again, dopamine is low, and nothing in oxytocin. So all of our happy hormones, right, with the serotonin is completely gone. So does that kind of make sense as to why you might feel like this? If my hormone in my brain, it's just not there, then I can't feel happy, right? I'm having trouble feeling there or getting there. So we're going to talk about treatments. Because I'm integrative, right, integrative physician, we're going to talk about a whole host of different treatments. There is an entire world of holistic treatments that you should be looking at, right? Pharmaceuticals is just one aspect. Prescription medications are great, but there are other things that we should not be ignoring. And some of those are exercise and movement, nutrition, right? What we're putting into our body is very important. It is how we feed our body, it's how we feed our soul. If we are putting in trash, we are going to get trash. So it's really about going back. We all know how we, quote, should be eating, right? What we should be eating, how we should be feeling, etc. Unfortunately, in the world that we live in, it's easier and very convenient to go and pick up something that's a little bit more processed, right? That has a little bit more refined carbohydrates and sugars. We're going to go into that in a little bit, but that can very much trigger or change our mood and bring on depression or anxiety. We're going to talk a little bit about dietary supplements, botanicals, which come from plants, mind-body approaches, very important, right? If you have ever been treated or sought out treatment for depression or anxiety, most of the time they might talk to you about medications, but also hand in hand they're going to talk about maybe therapy, right? That mind-body connection, talking to someone, reaching out, having that social interaction, because there's a synergistic effect. Both work equally well, but when you add them together, it works even that much better. So mind-body approaches are very important. Pharmaceuticals are those medications we talked about. Light therapy. Has anyone heard about light therapy with a light box? Excellent. Especially because we live so far north, I highly recommend this one. And we're going to talk about the details of a light box, how to use it, what is it good for, but especially with our long winters, right? And if we're not able to get outside and enjoy this beautiful sunshine and have that light, which is shown to make us feel better, give us more energy, and definitely help with that sleep-wake cycle, then a light box is needed, right? To help us kind of keep on that rhythm that we need. And then we're going to talk about aromatherapy. So let's begin with exercise. Now, exercise is very important, right, to the whole aspect of our health and how we feel and how we're sleeping, but it's also very important with the hormones, right, and how we might be feeling day to day. It has been shown that exercise can work just as well as medications. However, I would, so that's one thing that we could start, but I would not just say, let's stop here, right? It's all about that holistic approach. Let's try different things. But exercise is both aerobic, so like walking, tennis, running, swimming, but also anaerobic, more of that strength training, right? Lifting heavy things to build our muscles. Exercise is also really going to help us build our endorphins, right? Those happy, I feel really good after a workout, but then it's also going to expend that excess energy, so we might sleep better at night, right? A little bit more soundly. So then we can start again the next day, exercise again, feel better, everything's looking good, and then at night I'm sleeping a little bit better. So it's really good for that. I would highly recommend starting off really low and going slow, especially if we lead a sedentary life. If we are not used to exercising right now, let's just start walking 15 minutes a day. That's it. And if it's not 15, then cut it back to 7 and we'll work up to there, right? But it's really, we got to start where you're at. If you're not a marathon runner, do not go out tomorrow and run a marathon, right? If you're not lifting weights, do not join the strongest man competition. We got to start where you're at and build it up. So we're going to start walking. We're going to start using the stairs, right? Maybe take your friend up on that tennis match that they're always bugging you about. Or join a dance class. That's a great way. I love the idea of group exercise. Now, not everyone's game, right? Because they might be embarrassed. They don't want to work out in front of other people, or they might have issues around that. And that's something that we can work on too and work through. But with group exercise, not only are you exercising and getting your heart rate up and all your hormones going in the right direction, but you also have that social connection. And social connection, especially in depression and anxiety, is very important. Because if you feel depressed, right, or you're anxious about going outside, or you just don't have that energy, again, to get up or get out of bed, you're prone to what we call socially isolate, right? Not leaving the house, not wanting to go to the grocery store. Maybe you're ordering toilet paper off Amazon, right? Because you couldn't even think about going and interacting with someone. However, studies have shown that simple social interaction, having a group that expects you there and is really excited to see you, whether it's a sewing circle or a dance class, right? They are going to give you that social support that is very necessary in these diagnoses of depression and anxiety. Now, we're starting off at 15 minutes, but the goal, we don't want to end there, right? Longer tends to be better. The results with working out for 30, 40 minutes are even better than working out for 15. But, like I said, we're going to start where we're at and build it up. And then once we start feeling better, right, and we're starting that exercise, the exercise is important to continue on because it actually has been shown to help prevent further relapses, right, or further anxiety attacks. And because if we feel better, we definitely want to keep your mood up there, so definitely keep up with that exercise and movement. Now, nutrition. Nutrition is very important because it's how we are fueling our body. I spoke a couple of months ago about the anti-inflammatory lifestyle, and that's basically what we're going to talk about in nutrition here. It's more whole foods, right? It's more of the traditional way of eating. So you're having your protein, you're having your fish and your meat and your good fats, your avocados and your olive oils, and you're having your vegetables, and you're really not having a lot of processed foods. So without that processed foods, you're removing a lot of the refined carbohydrates, right? And that's more of a glycemic index, which is that next one, which is a low sugar diet. So removing the sugars and the refined carbs, which turn into sugar, has been shown to greatly improve mood. Because once we get, unfortunately, addicted to sugar, now our blood sugar is kind of going up and down, and we're roller coastering all day. And now we're up and we're down, we gotta eat something, right, to make us feel better and to perk us back up, and so then our blood sugar goes up and then it comes back down, and it's just causing chaos, if you can imagine what our blood sugar is doing, what it's doing to our emotions, right, and our hormones. So pulling back on the refined carbohydrates and those sugars, which unfortunately are hidden in everything, right? And so it takes a little bit more time of looking at things, looking at ingredients, making maybe a couple extra meals at home, saving that extra money, right? Don't go out to that restaurant every 2 days like I like to do. I'm going to make a meal. I'm going to eat the leftovers. I know it's made with whole foods. I put that time into it. I have fun doing it. You know, it's a family affair. Get other people involved. And that way you can control the sugar and the refined carbohydrates that are going into your body. You're still getting that good protein, good fats, right? All those veggies, and which make you feel better. And it's going to decrease inflammation. If you were not able to make the anti-inflammatory lifestyle lecture, highly recommend either watching it on the YouTube that we recorded or listening to it on my on the podcast, Whole Health Radio. Either way, I think anti-inflammatory diet and lifestyle is very important for a lot of different medical reasons, and this definitely being one of them. But if we could decrease your inflammation, not only would you feel better, but you're sleeping better, right? Which means then you have more energy the next day. If we decrease inflammation, you're having less pain. If you're having less pain, then you want to be more active when it's it's sunny outside, and it's a beautiful thing if we can decrease that inflammation. Something else, our third aspect is going to be caffeine. Now, this is tricky, right? Because a lot of us really like our coffee and tea, and our pops and our energy drinks and all sorts of stuff. The more caffeine we get, the worse our depression and anxiety tends to be, and especially with the anxiety aspect, because if you're already having some symptoms of anxiety with palpitations, or your heart is racing, or you might have trouble breathing, or your panic attacks, or you're shaking or trembling, or I just can't do that, you're already revved up. Adding caffeine to that is just putting fuel to the fire. You're just revving yourself more. Caffeine naturally increases your heart rate, so if you already have palpitations or heart issues, it's just going to make everything a little bit worse, right? And then if we're pounding the coffee, which we might actually be trying to self-medicate, if we feel like we're having low energy, right, because of some depression, or we just are so fatigued, or we just don't feel good, we think, you know what, that 6th cup of coffee is going to do it, right? It's not helping anyone. But caffeine, just like any other drug, basically, can be abused, and it often is. And we can't just cut it out cold turkey. Well, you can, but with that, you might get some caffeine withdrawals, right? Those headaches that people don't want to deal with. So a lot of times it's pulling back slowly. From that 6th cup, stop at 5. Do that for a good week, right? Then pull back to 4. And then let's say, hey, I do this for a social aspect, then switch to half caff, right? So you're still pulling back on your caffeine, you still get the benefits of the coffee, you're sitting around chatting with your friends. As you pull back on the caffeine, maybe you switch to tea, which has less caffeine. As you switch to tea and you're like, hey, this is totally fine, maybe you switch to herbal teas, again, even less. So you're kind of just weaning yourself off. As you wean yourself off, you are going to find that you don't need it anymore. You're feeling better, right? We're treating the underlying issues of the depression instead of trying to mask the symptoms with all that coffee. You're going to be sleeping better because you're not wired all the time. Your heart rate should go back down to normal. Your blood pressure should decrease. Everything is just a little bit better. So I'd say let's start paying attention to our caffeine use, especially if we have some of these symptoms with depression, anxiety. Dietary supplements. So a lot of times I'm going to say go to your diet. Let's talk about how we're eating, right? And we started that anti-inflammatory diet and lifestyle. But sometimes we need help. We cannot get, unfortunately, all of the nutrition from the food like we used to 50, 60 years ago, right? The soil's depleted, so it's not getting into our food, and then we're trying to eat it, but it's just not enough, so sometimes we need extra help. A lot of these supplements, like the omega-3 fatty acids, are very important for brain health, for feeling good, for decreasing that inflammation. Sometimes we cannot eat our way to about 3 grams of omega-3 fatty acids a day, because that's a lot of fatty fish. And some of us just don't want to be pounding salmon every day, right? So this is to supplement. It's not to absolutely, instead of, unless you're allergic to fish and can't stand it and doing anything, then I say absolutely, you're going to need this and take care of the whole thing. The omega-3s come in two different types. One of them is from fish oil, right? You're going to get your DHA and EPA, and another type is plant-based, your ALA. Now, plant-based is more of your walnuts or your flaxseed oils, etc. But as we talk about in that anti-inflammatory lifestyle lecture, your body has to convert the plant-based ALA omega-3s into the animal-based DHA and EPA. If you are not vegetarian or vegan, I say go ahead with the fish oils with that DHA and EPA, because then your body doesn't have to work that hard, right, to convert them. You're getting the dose you know you need, as opposed to when you convert from that flaxseed oil, which is still fabulous and I still use it, but I don't count it towards a lot of my omega-3s when I'm counting those, because you're going to lose a large portion when you're converting. Okay, so omega-3s are very important. My second favorite supplement with both depression and anxiety is a vitamin B complex. Now, a complex has all of your vitamin Bs. Please do not try and take them separately, because then you have 9 more pills to take, and who wants to do that, right? My favorite is a B100 complex. We have them over in our pharmacy, as well as we have the omega-3s. With going back to the omega-3s, because I start out at 2,000 or 3,000 milligrams, which is about 3 grams, what it states up there, for anti-inflammatory and depression and all of those aspects, I'm looking for a higher dose capsule. We have that in Nordic Naturals Pro Omega 2000. Each capsule, if you get that specific brand and make, has 1,000 milligrams or 1 gram. So now you're cutting back from 6 to 8 capsules, right, down to 3 to get your 3 grams or 3,000. So that's just my little tip for you. We're going to go back to the vitamin B complex with all of the fabulous Bs already in there. The 100 is basically a dose for all of them. Some of them are dosed in micrograms, some of them are in milligrams. You really don't have to worry about it if you get the whole complex and you're getting the B100s. Folic acid, I'm going to pull out, that's B9, is very important with depression and anxiety and comes in your B complex. But if you feel like, hey, I'm taking my B complex and I feel like I need another boost, we could possibly boost folic acid or folate, which is B9. That is important because it helps the antidepressant medications work better. It helps to make those hormones in our brain that we're trying to make anyway. And so if we're low in them, that's why the vitamin Bs help, but specifically folic acid or folate. Those last two, SAMe and 5-HTP. Salud. So 5-HTP is a precursor to serotonin. And if we remember a couple of slides back, serotonin is what we're trying to increase, right? Because it's very, very low in both depression and anxiety. So the 5-HTP is a natural product that our brain makes, and same with the serotonin and the hormones, we're just trying to boost it, okay? And so that's why that one works. The SAMe has over 100 different mechanisms in the body. It has been shown to be beneficial for not only depression, but osteoarthritis and stomach issues and stuff like that. So SAMe is also really great. Some people choose to start with SAMe or 5-HTP before going to pharmaceutical medications, and that's fine too. You just you're going to talk to your provider about it. You're going to start low. You're going to titrate up and kind of see how you feel. Both of those, highly recommend taking with the omega-3s and vitamin B complex because they're supporting each other, right? Botanicals. Botanicals we get from our excellent plants in the garden. We've been using, right, for thousands of years. Medicinal herbs that are very popular in both depression and anxiety. St. John's wort, right? Has everyone heard of that one? It tends to be very popular. It works really well, but we have to be careful because it can interact with other medications, with other supplements, with other things. That's why it's so important that you are always in contact with your provider saying, hey, I'm thinking about starting this new supplement or botanical. Do you think it's going to interact with my other medications? Amy Sapola in the pharmacy is also really good about that. She can do a an NTM sit down with you and discuss all of your medications, all of your supplements, talk about possible interactions, what might work, what might need to be tweaked, but that's why it's so important. So, valerian root has been used specifically for anxiety and insomnia, sleep. It is not a one-off like melatonin for sleep. This needs to be taken every day to really help us get to sleep, right? And with that, because it's kind of a downer helping us sleep, it also helps to bring down our anxiety. The kava kava is also used for anxiety. It comes as a drink. It is a root. The drink is very earthy. So if you're not one for bitter, earthy, rooty drinks, stick with the other forms that it has, either the capsules or other things, so you don't have to taste it. I tasted it for you. I'm here to tell you it's earthy. Take that, leave that, however you want. But it's becoming very popular, and you'll actually hear about these kava kava bars in the larger cities. And people will go in just like a coffee bar and order their kava kava drink, and they have different brands and they have different types, and and the fun ones, they'll serve you in a coconut shell, so you feel like, oh, you're all authentic. But a lot of people are finding fantastic results with the kava kava, and that's why they're popping up. It's becoming really popular, but that's really good for anxiety. Chamomile, right? We all know chamomile tea is very soothing, brings us back down. Rhodiola is good, help mostly for depression, because it's a mood booster, right? It helps us give a little bit more energy. Mind body. Mind body is very broad, right, as a topic, and therapies that are available. When I think mind body, I'm thinking everything from talking to myself, right, meditating, doing movements like yoga or Tai Chi, and also talking to others, like cognitive behavioral therapy, where you see someone, whether that's a psychologist or a social worker or whoever we have, that we can start processing these emotions. Sometimes people with depression and anxiety have trouble processing these emotions, right? And so it's really beneficial to have this next step. Therapy has been shown to help with depression and anxiety. It takes a little bit longer, maybe than some other these other treatments, but if you use them together, you get much greater results than if you use all of these separately. Okay, so highly recommend therapy. There's also mindfulness-based stress reductions. Those courses are out there, books, guided imagery, meditation. I like, on the back table as we leave, there's 4 handouts, and one of them is about meditation. It talks about how is it good, how can I start, all that, the different types. There's tons of different types. When people sit in contemplation and prayer, it is basically the same thing as meditating. So I will use whatever word you want to use as long as you start doing it, right? And it's sitting there thinking about it, using positive affirmations, thinking about the day, learning how to process the emotions as they come over you will really benefit depression, anxiety. It's going to help us feel a little bit calmer, like we have a little bit more control over our lives. So meditation is back there. So is healing through forgiveness. A lot of times, major life events have happened, and they cause us great stress, right? Which then can lead to this depression or anxiety, and we tend to forget to forgive. We hold on to a lot of things. And because of that, they can linger in the subconscious, they can linger in the brain, they cause us to stay up at night, and we possibly don't even know why. And it's because we haven't gone through this process. So another handout in the back is healing through forgiveness. Another one is positive affirmations about a loving meditation. Another one that's very popular is journaling. If you have ever seen me in clinic, I have most likely asked you to start a journal. Now, there are hundreds of different types of journals. Some of them that I might ask you to keep is a food journal, right? I want to know how you're eating, how are we making these changes. Some journaling is for your emotions. I want to start, if I start, having almost an anxiety or a panic attack and I cannot get these thoughts out of my head, sometimes it's easier to write it down, right? And it doesn't have to be longhand, it could be on the computer. I have some young patients that do it on their cell phones because they're used to that. But it's getting those emotions and what your thoughts are on paper. It's very therapeutic. So again, one of the handouts on the back is about journaling for your health and how that can help. But yeah, excellent. Mind-body therapy, very important. Pharmaceuticals. Now, when you think depression or anxiety, a lot of times you're thinking, oh, medications, which medicines do I need to be on? They have such funky names, where do I start? The most popular one is going to be this first one, selective serotonin reuptake inhibitor, or an SSRI. Okay, this is more like your Paxils, your Zoloft, your Lexapro. If you guys have ever heard those brand names, those are all SSRIs. And how they work is that this is a nerve, right? And then that's kind of the tissue that we're trying to, we have receptors in. These green things are the follicles that are releasing the red dots or serotonin. So as the nerves are releasing serotonin, they're trying to help us feel better. Some of them go into the receptor sites, and some of them get reuptake right in that nerve, so they kind of get recycled. What this medication does, it's an inhibitor, which means it stops the reuptake. So it comes in here and it sits. It sits in that little follicle, and it blocks the nerve from reuptaking the serotonin. What that does is that if it blocks me reuptaking the serotonin, there's now more serotonin that's hanging out, so that more receptors can grab onto them. So therefore, that little bit of serotonin is now making a much bigger effect because your body's not reabsorbing it. Does that kind of make sense? Mm-hmm. Similar to this next one, serotonin norepinephrine reuptake inhibitor. There's other antidepressants, and sometimes people will use other medications like beta blockers for anxiety, propranolol. If you have a significant anxiety about a specific thing, let's say it's public speaking, or flying on planes, or anything like that, the beta blocker can be taken right as you're about to do something. It brings down your heart rate, makes you feel a little bit better, so you're able to go through that thing. What's nice is that the beta blocker then stops working. You're able to go about your life because that specific event, whether it's flying on a plane, right, or public speaking, has now ended. There's also benzodiazepines that have been used for anxiety. These are highly addictive, however, and some studies have shown that people on benzos have a higher likelihood of having depression because they're kind of a downer. So it's kind of a twofold, because people with anxiety or panic attacks might heavily depend on these benzos, but then we get to the point where now you need more and more, right? Because we're getting used to them, we need to increase the dose, we need to increase the frequency, however it is, and now it starts snowballing. So definitely not one of my favorites. Light therapy. Sorry, guys. Light therapy is very common for seasonal affective disorder. Seasonal affective disorder is what happens when the days start getting shorter and we're having less sunlight outside. You'll notice that as we go into autumn and winter, right, our mood starts to go down, and we just can't get that energy, and we just don't know what's wrong. It could be seasonal affective disorder. And it could be because we're not getting that sunshine and that light in our eyes that we're used to in the summer that gave us great, energy and pumped us up and made us feel good. So they developed these light boxes to help. Now, they come in all sorts of different sizes. This one's a fairly large one. They also come in small, kind of personal sizes that I have on my desk. And they have an even smaller one that you can fit in your pocket or your travel bag. If, let's say, you're flying to Seattle or wherever it is, they have ones that you can easily take with you. The important part of the light therapy is actually the dosage. The dose is in what we call lux, L-U-X. And it's very important to look, if you're looking at a light box, to see what or how strong this light is. Some of them are very, very soft and very low at 2,000. My preferred is 10,000, so mine that I use is 10,000 LUX or 10,000 lux. And the reason is because the 10,000 requires a much shorter time and is much stronger than the 2,000, right? You're going to need to sit in front of that 2,000 for an hour, hour and a half to get the same dosage, if you will, out of a 20-minute session in front of a 10,000 one. So if you're looking for them, if this interests you, definitely go for the 10,000. Start off with about 20 minutes. 20 minutes first thing in the morning as you're having your breakfast, as you're reading the newspaper, as this lady's doing. She's basically hanging out, reading, all that good stuff. It is off, not directly in front of her. It is about a 45-degree angle to what she's looking at. Very important to not look directly in the light. It will hurt your eyes. And then I will be seeing you for momentary blindness and all sorts of stuff. So don't look into it. It's very strong. Put it off at a 45-degree angle. It can be slightly high. I leave mine on my desk. That angle doesn't really affect it as long as it's about a 45. You need to be within 3 feet of your light. Again, do not put it directly on your face or within 6 inches, but that's why it works when, if you're going to read, put it on your desk. If you're going to have breakfast, put it on the table, however it is. And sit there for about 20 minutes and enjoy that artificial sunshine. Very important, again, in the winter. Some people will then move to 20 minutes first thing in the morning, and then maybe around noon. Then you can increase the time from there. This has been shown to not only improve your mood, right, for the depression kind of aspects, but also help with the sleep-wake cycles. So because it is the bright light, it's going to increase those hormones and your energy levels, and that's why it's important to do first thing in the morning, and your last session should probably be around noon. Do not do it after that, because then it's going to interrupt your sleep, right? If your body thinks, oh my gosh, it's so bright outside and it's 5 o'clock at night, just like now, we might have issues winding down and getting ready to go to bed. Again, that's why it's also important, sleep hygiene, turning off the lights, getting ready to bed. We're going to talk about that next time when I talk about sleep problems and insomnia. But that's kind of how it goes. So the bright light first thing in the morning, maybe another session right at noon, and then turning it off so you can kind of wind down is going to help your body to get in that cycle of, oh, hey, I need this energy first thing in the morning, gives you a little boost. Then we're going to go to sleep. I'm going to sleep great now because I had all that energy during the day, and now it's night, and now it's dark, and it's really going to help that way. This does not beat at all being outside when it's beautiful like this, right? There's nothing better than natural sunshine, going out, taking a walk, being out in nature. But, as we all know, in winter, we don't have that luxury a lot of times. So that's where the importance of the light box comes in. Aromatherapy, very popular and is very useful because it's something that we can use at a moment's notice. There are tons of different scents and essential oils that we can use for depression and anxiety. So there's one out there that you will like. If you do not like the smell of ylang ylang, right, or lavender, or I'm allergic to rose, or whatever, choose a different one. Now I will say one that is of fantastic use, especially to kind of boost moods, are your citrus oils, right? Your lemons, your grapefruit, your bergamot, which is kind of like the lime-looking orange, even orange itself, really fantastic. Helps to bring everything up, right? Smells a little tropical, brings that energy so you're feeling a little bit better and not so down. Lavender is really good for anxiety. It's a nice relaxing one, so you can use it right before bed. It helps to bring everything down. So if you tend to run really high, maybe and a little bit more anxious, you can put the lavender on, and it helps to calm everything down a little bit. Again, this is not an exhaustive list. This is just a couple that are out there that are very popular, that have been proven to be beneficial. Very important to spend time in nature. Now, we are very lucky that we live in a beautiful state, that we are able to be outside in July, because I'm telling you, as a native Texan, you cannot do that in the South. So being outside, enjoying that sunshine, nature is going to help you, and we call it vitamin N, right? And it is almost needs to be prescribed because it is so important and it is so beneficial. We have got to get out there, enjoy that sunshine, smell the beautiful flowers, walk your dog, you know, start on that exercise and movement and in nature. Now you got 2 in 1, right? It's very, very important. It helps tremendously with your mood, helps with that depression, anxiety, helps to calm things. If we're having anxiety, if you find a stream, it's nice and relaxing. Maybe we can practice our guided imagery, meditation, even some yoga poses. But natural sunshine is going to help us tremendously as well. That is the end of depression and anxiety. This next slide, we're going to talk about upcoming lectures. The next one in August 8th, same time, it's going to be Amy Sapola, the pharmacist. She's going to be in here. She's going to talk about the integrative approach to medication therapy management. I kind of alluded to it earlier when I said you can meet with her and she'll talk to you about all your medications and your supplements and your vitamins and everything that works well. That lecture on August 8th will be all about that and how that works and who's it good for, etc. So highly recommend. I'll be back in September. On September 12th, I'm going to be talking about improving your sleep quality, right? People with sleeping problems, insomnia, etc. We're going to talk about sleep in September. In October, Amy will be back and she'll talk about healthy digestion. And then November 14th is a date that a lot of people have been asking about. I'm going to be talking about CBD oil. Now, what's really exciting is that some of the laws in Minnesota about CBD oil have changed, and they take effect in January. So November is going to be a perfect time to talk about it before everything kind of changes. So we're going to talk about that November 14th, all about the benefits, facts, CBD oil, what is it good for, how do I use it, all the different types, etc. Excellent. Well, thank you guys so much for coming. Please fill out the evaluation form. On the bottom of the evaluation form,